Every 66 seconds, another family hears the words no one ever wants to hear. Your loved one has dementia. Before this video is over, dozens more people will receive that life-changing diagnosis. Most assume memory loss is simply part of getting older. But after years of treating older adults, I can tell you that's not always the truth. I've met countless patients who spent decades balancing careers, raising families, remembering every birthday, every anniversary, every important detail. Then, almost without warning, something changed. They began forgetting familiar names, misplacing everyday items, getting lost on roads they had driven for years. Families blamed aging. Some even believed Alzheimer's had arrived. Yet in more than a few cases, the real culprit wasn't age at all. It was a medication they had been taking every single day. That's what makes this conversation so important. Many of the drugs we're about to discuss are prescribed by physicians, sold in trusted pharmacies, or even available over the counter without a prescription. Millions of Americans take them believing they're completely harmless. Yet growing research suggests that several of these medications may quietly interfere with memory, concentration, and even long-term brain health, especially in older adults. Today, we'll count down 9 medications that have been repeatedly linked to cognitive decline and memory problems. Some may surprise you. Others are probably sitting in your medicine cabinet right now. And be sure to stay until the end, because the number 1 entry isn't a single drug at all. It's a hidden combination that dramatically increases the risk of memory loss, yet almost no one is warned about it. One medication in particular, coming up later, is prescribed to millions of seniors every year for a condition that seems completely harmless. New evidence suggests it may be affecting the brain long before symptoms become obvious. You won't want to miss that. Before we begin, let me know in the comments how old you are and how many prescription medications you take every day. I read your comments carefully, and they help shape the topics I cover in future videos. Let's begin. One of the easiest medications to overlook is also one of the most common. It's sold in nearly every pharmacy, found in countless homes, and many people have taken it for decades without giving it a second thought. I'm talking about diphenhydramine, better known by its brand name, Benadryl. Most people reach for it to treat allergies. Others use it as a nighttime sleep aid or to ease cold symptoms. Because it's available without a prescription, many assume it's one of the safest medicines they can take. Unfortunately, when it comes to the aging brain, that's far from the full story. Benadryl belongs to a family of medications known as anticholinergics. While that name sounds complicated, the effect is actually quite simple. These drugs block acetylcholine, one of the brain's most important chemical messengers. Acetylcholine plays a critical role in forming new memories, maintaining attention, and keeping thinking sharp throughout the day. As we grow older, our brains naturally produce less of this chemical. That means every remaining signal becomes increasingly valuable. When a medication blocks those signals, the brain has a much harder time creating and storing new memories. The hippocampus, the area responsible for learning and memory, appears to be especially vulnerable. I've seen older patients who took a simple nighttime allergy pill for years slowly develop persistent brain fog. They struggled to remember conversations, forgot appointments, or found themselves searching for words they once used effortlessly. Most never suspected their sleep medication could be contributing. Research has become increasingly difficult to ignore. Several recent studies have found that older adults who regularly use strong anticholinergic medications face a significantly higher risk of developing dementia compared with those who avoid them. The risk appears to increase the longer these medications are used. The good news is that safer alternatives often exist. If you're taking Benadryl primarily for seasonal allergies, newer antihistamines such as loratadine or cetirizine generally have much less effect on the brain because they don't cross into brain tissue as easily. If you're using it to help you sleep, it's worth discussing other options with your healthcare provider rather than relying on the same pill night after night. Most importantly, never assume that an over-the-counter medication is automatically harmless simply because you don't need a prescription to buy it. Sometimes the greatest risks are hiding in plain sight. Another medication that rarely raises concern involves a completely different part of the body. Millions of people take these pills every morning to control acid reflux, heartburn, or stomach ulcers. They often work remarkably well, which is exactly why many people continue taking them for years without ever thinking twice. These medications are called proton pump inhibitors, commonly known as PPIs. Popular examples include omeprazole, sold as Prilosec, and esomeprazole, known as Nexium. Their job is simple. They dramatically reduce the amount of acid your stomach produces. Less acid usually means less heartburn. For many patients, the relief feels life-changing. But stomach acid serves another important purpose beyond digestion. It helps your body absorb several nutrients that are essential for healthy brain function, especially vitamin B12. It also plays a role in maintaining healthy magnesium and calcium levels. When stomach acid remains suppressed for months or years, those nutrients can gradually decline without producing obvious symptoms. Vitamin B12 is particularly important because it helps maintain the protective covering around nerves and supports healthy communication between brain cells. Low B12 levels have long been associated with confusion, poor concentration, numbness, balance problems, and memory impairment. In some individuals, the symptoms can closely resemble early dementia. Large population studies have reported that long-term PPI users appear to have a higher incidence of cognitive decline than individuals who do not regularly take these medications. Researchers are still debating the exact mechanisms involved, but nutrient deficiency is considered one of the leading explanations. Other studies have also suggested these medications may influence proteins associated with Alzheimer's disease, although more research is still underway. None of this means everyone should immediately stop taking a PPI. For many people, these medications prevent serious complications, such as bleeding ulcers or severe esophageal damage. The key is making sure they're still necessary. Many patients continue taking them simply because no one ever suggested trying a lower dose, or reevaluating whether the medication is still needed. Others may be able to transition to different treatments under their physician's supervision, or improve symptoms through weight management, dietary adjustments, avoiding late-night meals, and other lifestyle changes. If you've been taking a proton pump inhibitor every day for years, it's worth asking your doctor whether your vitamin B12 and magnesium levels should be checked. A simple conversation today may help protect both your digestive health and your brain in the years ahead. And the next medication on our countdown may be even more surprising, because it's prescribed for a condition many older adults are simply too embarrassed to talk about. The next medication on our countdown treats a condition that millions of older adults experience but few enjoy discussing. Because the symptoms can be embarrassing, most people are simply grateful when they finally find something that works. Unfortunately, relief for the bladder may sometimes come at a hidden cost to the brain. One of the most common examples is oxybutynin, often prescribed for overactive bladder. It helps reduce the sudden urge to urinate, decreases frequent bathroom trips, and allows many seniors to regain confidence when leaving the house. For someone whose daily routine has been controlled by the nearest restroom, the improvement can feel remarkable. But the way oxybutynin works is exactly what worries many neurologists and geriatric specialists. Like Benadryl, oxybutynin blocks acetylcholine, the same chemical messenger your brain depends on for learning and memory. Unlike some medications that stay mostly outside the brain, oxybutynin crosses the blood-brain barrier quite easily. Once there, it can interfere with communication between brain cells in areas responsible for attention, recall, and forming new memories. The problem isn't usually dramatic overnight memory loss. Instead, it's often a slow decline that develops so gradually people hardly notice it. A missed appointment here, forgotten conversations there, walking into a room and wondering why you came. Many families simply assume it's normal aging. Research tells a different story. Several large observational studies have found that older adults taking strong anticholinergic bladder medications for extended periods were significantly more likely to develop dementia than those who did not. The risk appears to rise with both the dosage and the length of treatment. Perhaps the most troubling part is that many patients are never warned this could happen. They're told the medication may cause dry mouth or constipation, but very few hear that it may also affect thinking and memory over time. Fortunately, treatment options have evolved. Newer medications, such as mirabegron, work through an entirely different mechanism. Instead of blocking acetylcholine, they relax the bladder muscles using another pathway, allowing many patients to achieve similar symptom control with considerably less impact on cognitive function. If you've noticed increasing forgetfulness after starting bladder medication, don't ignore it. Bring those concerns to your physician. Sometimes a simple medication adjustment can make a meaningful difference. The next medication surprises many people because it's one of the most prescribed drugs in the world. Statins have saved countless lives by lowering cholesterol and reducing the risk of heart attacks and strokes. For many patients, they're an essential part of staying healthy. This isn't about suggesting people should stop taking them. It's about understanding that every medication has benefits as well as potential side effects. Your brain contains an enormous amount of cholesterol. In fact, it's one of the richest cholesterol-containing organs in the body. That cholesterol isn't there by accident. It's used to build and maintain the protective insulation around nerve cells, allowing electrical signals to travel efficiently throughout the brain. Some statins, particularly those that easily enter brain tissue, may influence this process more than others. Although research has produced mixed results, several studies have reported that a small percentage of patients experience memory problems, difficulty concentrating, or episodes of confusion after beginning statin therapy. In many cases, these symptoms improve after switching medications or adjusting the dosage under medical supervision. Scientists continue to debate exactly why this occurs. Some believe certain statins temporarily reduce cholesterol availability inside brain cells. Others suggest they may alter energy production within neurons. Regardless of the exact mechanism, the reports have been consistent enough that both physicians and regulatory agencies acknowledge cognitive side effects can occur in susceptible individuals. Not every statin behaves the same way. Medications such as pravastatin and rosuvastatin generally enter the brain less readily than others, which may explain why they appear less likely to produce cognitive complaints in some patients. If you've been taking a statin for years without any problems, there's no reason to panic. These medications continue to provide tremendous cardiovascular benefits for millions of people. However, if you noticed persistent brain fog, forgetfulness, or confusion shortly after starting a statin or after increasing the dose, it's worth discussing with your doctor. A different statin or a lower dose may provide the same heart protection while reducing unwanted side effects. Never stop taking cholesterol medication on your own. The goal is to find the safest treatment that protects both your heart and your brain. Before we continue, take just a second to press the like button if you're finding this information helpful. It helps more families discover these videos, and it encourages us to continue sharing evidence-based health information for older adults. Now we're moving into the medications where the connection to memory becomes even stronger. The next one is prescribed every single day for anxiety, panic attacks, and insomnia. Yet many people taking it have no idea how profoundly it can affect the aging brain over time. As we move further down the list, the medications become even more concerning because they don't just affect memory occasionally. In many cases, they change the way the entire brain functions day after day. One of the most common examples is a group of medications called benzodiazepines. You've probably heard some of their names before. Lorazepam, better known as Ativan, alprazolam, sold as Xanax, and diazepam, known as Valium. These medications are prescribed every day for anxiety, panic attacks, muscle spasms, and difficulty sleeping. For many people, they seem almost miraculous at first. The anxiety quiets down, sleep finally returns, the constant tension begins to fade. But the brain quickly adapts to these drugs. Benzodiazepines work by increasing the activity of GABA, the brain's primary calming neurotransmitter. In small doses and for short periods, this can be extremely helpful. The problem begins when they're taken for months or years instead of weeks. Rather than simply calming the anxious parts of the brain, these medications gradually slow activity throughout many regions involved in attention, learning, and memory. Mental processing becomes less efficient. New memories become harder to form. Reaction times slow, concentration fades, and many patients begin describing a persistent mental fog they can't quite explain. I've had patients tell me they no longer felt mentally sharp enough to follow conversations or finish crossword puzzles they once completed with ease. Others noticed they were forgetting recent events while older memories remained perfectly clear. Many blamed stress. Some blamed aging. Few suspected the medication they had trusted for years. Research has repeatedly shown that long-term benzodiazepine use in older adults is associated with a substantially higher risk of cognitive decline and dementia. The risk appears greatest in people who use these medications continuously for several months or longer, particularly with longer-acting drugs that remain in the body for extended periods. Unfortunately, these medications present another challenge. Over time, the brain becomes physically dependent on them. If they're stopped suddenly, withdrawal symptoms can be severe. Anxiety may return even stronger than before. Insomnia often becomes worse. Some patients experience tremors, confusion, or even seizures. That's why stopping abruptly is never recommended. If you've been taking one of these medications regularly, the safest approach is to work closely with your healthcare provider on a slow, carefully supervised taper if a change is appropriate. Many people can successfully transition to safer treatments for anxiety or insomnia, but it should always be done gradually. The goal isn't to frighten anyone away from medication. It's to recognize when a medication that was originally intended for short-term use has quietly become a long-term source of cognitive problems. The next medication surprises many people because it isn't always prescribed for depression. In fact, countless older adults receive it for nerve pain, chronic headaches, arthritis discomfort, or difficulty sleeping. The medication is amitriptyline. For decades, it has been one of the most versatile prescriptions in medicine. Physicians have used it to treat everything from migraines to fibromyalgia, because in many cases, it genuinely helps. But amitriptyline also happens to be one of the strongest anticholinergic medications still commonly prescribed today. Once again, we return to acetylcholine, the same brain chemical we've discussed throughout this countdown. Every time this chemical is blocked, communication between brain cells becomes less efficient. Learning slows, short-term memory weakens, concentration becomes more difficult. With amitriptyline, that blocking effect is particularly powerful. Large studies following older adults over many years have consistently found that people with the highest lifetime exposure to strong anticholinergic medications face a significantly greater risk of developing dementia later in life. Amitriptyline repeatedly appears among the medications contributing to that burden. The concerning part is how quietly these changes often develop. Someone may begin taking a small bedtime dose to help them sleep. Months become years. They gradually become more forgetful, struggle to find words during conversations, or lose confidence in their ability to remember simple daily tasks. Because the decline happens so slowly, neither the patient nor the family connects it to the medication. Many assume it's simply part of getting older. Fortunately, better options are now available for many of the conditions amitriptyline was originally prescribed to treat. Depending on the situation, physicians may recommend newer antidepressants with much lower anticholinergic activity, alternative medications for nerve pain, or non-drug approaches for chronic insomnia. The best choice depends entirely on the individual. But the important point is that alternatives often exist. If you've been taking amitriptyline for a long time and have noticed increasing memory problems, don't stop it on your own. Instead, ask your doctor whether it's still the most appropriate medication for your current needs. Because coming up next is perhaps the biggest surprise so far. It's one of the most commonly prescribed antidepressants in America, and most people believe it's among the safest medications available. Yet for older adults, this particular antidepressant stands apart from nearly every other drug in its class for one very important reason. The next medication catches many people off guard because it's part of a class of drugs that are generally considered safe and effective. Physicians prescribe these medications every day to help people recover from depression, reduce anxiety, and improve overall quality of life. But one member of this family stands out for all the wrong reasons. That medication is paroxetine, commonly known by the brand name Paxil. Unlike most newer antidepressants, paroxetine has a unique characteristic that becomes increasingly important as we grow older. In addition to affecting serotonin, it also has significant anticholinergic activity. That means it's capable of interfering with the same acetylcholine system we've been discussing throughout this video. The system your brain relies on to create memories, maintain attention, and process new information. Most people have no idea this difference exists. They hear the term SSRI and naturally assume every medication in the group behaves the same way. In reality, paroxetine is quite different from medications such as sertraline or escitalopram when it comes to its potential effects on cognitive function in older adults. Researchers have followed thousands of seniors taking various antidepressants and noticed a consistent pattern. Older adults using paroxetine were more likely to experience declines in short-term memory, attention, and verbal recall compared with patients taking other SSRIs. These changes often appeared gradually, making them difficult to recognize until family members began noticing repeated questions, forgotten conversations, or increasing difficulty managing everyday tasks. The irony is difficult to ignore. A medication prescribed to improve emotional well-being may, in some individuals, slowly reduce the mental clarity needed to fully enjoy life. That doesn't mean paroxetine is a bad medication. For some patients, especially younger adults, it can be highly effective and well tolerated. But age changes the way our brains respond to medication. What works well at 40 may no longer be the safest choice at 75. That's why many geriatric specialists recommend considering other SSRIs first when treating depression or anxiety in older adults whenever appropriate. Medications like sertraline and escitalopram generally have much less anticholinergic activity and are often preferred because they place a smaller burden on cognitive function. If you're currently taking paroxetine and it's working well, don't stop it simply because of what you've heard today. Depression itself can also impair memory and concentration, and suddenly stopping antidepressants may lead to serious withdrawal symptoms. Instead, have an informed conversation with the physician who prescribed it. Ask whether it's still the best option for your age and medical history. Sometimes the answer will be yes. Sometimes a safer alternative may provide the same emotional benefits while placing less stress on the brain. Now we arrive at one of the medications that concerns me the most. Not because it's always inappropriate, but because it's so often prescribed for reasons it was never originally intended to treat. I'm talking about antipsychotic medications. Drugs such as quetiapine, risperidone, and olanzapine were developed to treat serious psychiatric illnesses like schizophrenia and bipolar disorder. For those conditions, they can be life-changing and absolutely necessary. But over the years, they've increasingly been prescribed to older adults for completely different reasons. Difficulty sleeping, restlessness, agitation, confusion, behavioral changes associated with dementia. In nursing homes and assisted living facilities, these medications are sometimes used simply because an agitated patient is difficult to manage. While there are situations where they may be appropriate, they should never become the automatic solution. These medications work by blocking dopamine, another critical chemical messenger inside the brain. Dopamine influences far more than mood. It's deeply involved in motivation, attention, decision-making, movement, and memory. When dopamine activity is suppressed too much, many people become noticeably slower, both physically and mentally. Families often describe heartbreaking changes. Someone who once loved conversations now sits silently for hours. A person who always laughed and joked suddenly seems emotionally distant. Simple decisions become overwhelming. Faces appear expressionless. It can feel as though the person's personality is slowly fading, even though they're still sitting right in front of you. Large studies have found that older adults receiving antipsychotic medications for behavioral symptoms often experience faster cognitive decline than similar patients who are managed with non-drug approaches whenever possible. These medications have also been associated with increased risks of falls, strokes, severe sedation, and even higher mortality in certain elderly populations. That's why medical guidelines consistently recommend using them only when the potential benefits clearly outweigh the risks. If someone you love has recently been started on an antipsychotic medication, don't be afraid to ask an important question. Why is this medication necessary? Is it treating a diagnosed psychiatric illness? Or is it simply being used because managing difficult behaviors has become challenging? Sometimes treating an untreated infection, improving sleep, correcting dehydration, reducing unnecessary noise, or better controlling pain can significantly improve agitation without exposing the brain to powerful medications. When medication truly is necessary, the lowest effective dose for the shortest possible time is generally the safest approach. And now we've reached the final entry. Ironically, it isn't one medication at all. It's something far more common and potentially far more dangerous than any single pill on this list. Now we've reached the final entry. Ironically, it isn't a single medication at all. In many ways, it's even more dangerous because it often develops slowly, almost invisibly, until the damage has already begun. It's called anticholinergic burden, and it's one of the most overlooked threats to brain health in older adults. Here's what that means. Imagine someone takes Benadryl at night to help them sleep. They also take oxybutynin for bladder control. A few years earlier, they were prescribed amitriptyline for nerve pain. None of those medications seems particularly alarming on its own. Each one was prescribed for a legitimate reason. Each one appears to solve a different problem. But inside the brain, they're all doing something remarkably similar. Every one of them blocks acetylcholine. Instead of one medication placing stress on your memory system, you now have several medications attacking the same pathway at the same time. The effects don't simply add together. They often amplify one another. Think of acetylcholine as the electrical wiring that allows different parts of your brain to communicate. Blocking one wire may dim the light slightly. Blocking several at once can leave entire rooms in darkness. This is why some older adults experience what seems like a sudden decline. Their memory becomes unreliable. They lose focus during conversations. Simple decisions become difficult. Family members begin wondering if dementia has suddenly appeared. In reality, the brain has been carrying a growing medication burden for years. Several large studies have shown that older adults with the highest cumulative anticholinergic burden have dramatically higher rates of dementia compared with those taking little or none of these medications. What's even more concerning is that many patients never realize they're taking anticholinergic drugs at all. They simply trust that if each prescription came from a doctor, everything must be working together safely. Unfortunately, medicine doesn't always work that way. Different specialists often prescribe medications without seeing the complete picture. One physician treats allergies, another manages bladder problems. Someone else prescribes medication for sleep or chronic pain. Each decision may be reasonable on its own, yet together they can place enormous stress on the aging brain. The encouraging news is that medication-related cognitive decline is sometimes reversible. Unlike Alzheimer's disease, which gradually damages brain tissue over many years, medication-induced brain fog often improves once the underlying cause is identified and corrected. I've seen patients become noticeably sharper within weeks after unnecessary medications were carefully reduced under medical supervision. They became more engaged in conversations. They remembered appointments again. Family members often described it as though someone had turned the lights back on. That's why one of the most valuable things any older adult can do is schedule a comprehensive medication review. Bring every prescription, every over-the-counter medication, every vitamin, every herbal supplement. Review them one by one with your physician or pharmacist and ask a simple question. Do I still need this? Sometimes a medication remains absolutely essential. Sometimes the dosage can be lowered. Sometimes a safer alternative is available. And sometimes a medication that was meant for a few weeks has quietly remained on the list for years, without anyone questioning whether it's still necessary. Small changes can have a surprisingly large impact on both quality of life and long-term brain health. If today's video taught you anything, I hope it's this. Never assume memory loss is simply an unavoidable part of aging. Sometimes the cause isn't age at all. Sometimes it's hiding inside the medicine cabinet. The sooner medication-related cognitive problems are recognized, the greater the chance that mental clarity can be preserved, or even restored. Now I'd like to hear from you. Have you ever noticed increased forgetfulness after starting a new medication? Were you surprised to learn that some commonly prescribed drugs may affect memory over time? Share your experience in the comments below. Your story could encourage someone else to ask an important question at their next doctor's appointment. And before you leave, don't miss the next video. Your body often reveals early warning signs long before serious disease develops. In our next episode, I'll show you several changes in your fingernails that may point to hidden problems involving your heart, kidneys, circulation, or nervous system. Subtle clues many people overlook until it's too late. Thank you for watching. Take care of your brain, stay informed, and I'll see you in the next video.